Okay, my name's Noah. I'm going to be your discharge nurse today. Is it okay if I sit down?
Yeah.
Alright, so I'm here to talk to you today about the new medication that you got put on called lithium carbonate. Here's your discharge packet with some information.
Okay.
So you were prescribed this medication to help your bipolar affective disorder, and this medication is used as a mood stabilizer to treat recurrent bipolar affective disorder and also depression associated with it. So it helps to stop the release of certain chemicals in the brain that can cause unstoppable mood changes, and we now have you taking 300 milligrams 3 times a day, so 900 milligrams total. And this may be increased by your outpatient therapist when you see them next Tuesday.
Is this something that I'm going to take forever?
So as of right now, we're not sure, but that is something you can talk to your outpatient provider about in the future. But this medication has to be taken strictly as prescribed and is very dangerous to stop taking it suddenly. It helps to set phone reminders of when to take this medication, so you'll get a notification 3 times a day on your phone. Or also, there's those weekly pill boxes, so you don't take too much or too little of it. At the beginning of the week, you can put your medication in it.
Am I going to be able to go home soon?
So first I'd like to talk to you about a few side effects and other key points about this medication. So I brought this brochure that you can take home with you. So if you flip open to the middle in that, I have some side effects listed where you have to contact your healthcare provider immediately. So those side effects are fainting, lightheadedness, abnormal heartbeat, shortness of breath, and also suicidal thoughts. So again, if you're facing any of these, you should really go to the nearest emergency room or contact your healthcare provider.
Are these all the side effects?
So this pamphlet shows more of the less harmful side effects, such as depression, dizziness, tremors, dry mouth, and extreme thirst, nausea, diarrhea, urinary frequency, muscular twitching, cold sensitivity, and weight fluctuations such as weight gain or weight loss.
What can I do to prevent these side effects?
So it'll be trial and error at first. With the dry mouth, it's beneficial to perform oral care and like brush your teeth on a regular basis, and that'll help prevent it. You should drink at least 8 glasses of water a day, and that'll help to combat that extreme thirst. So you may experience urinary frequency, so it's important not to hold in your urine to pee when you have to go, because you could have a UTI, like you could get one, and that can cause other problems. If it's cold outside, you're going to want to bundle up and make sure you wear extra clothing to help combat cold sensitivity. And also, it's important to eat a well-balanced diet to prevent extreme weight fluctuation. And to help combat the diarrhea, you can take increased fiber in your diet, like we have Fiber One bars, and that'll help all of these side effects. There's little things that you can do.
Do I take this medication with any food?
So it's recommended that you take it with food. It'll increase the absorption rate. Make sure that you swallow the whole tablet and don't chew or crush the tablet. And you also have to make sure you stay well hydrated, because if you're dehydrated, your lithium levels in your body can actually become toxic levels.
Do they have to keep doing any blood tests for me?
So in order to make sure that your levels are steady, we start you off with doing blood work about 3 times a week for the first month, and then this increases to weekly, and then monthly, so on. And this may be changed by your outpatient provider as time goes on. So are your parents or any family members aware that you're here or will be taking this medication?
No, not at all. My parents were raised believing that there's no such thing as mental illness, so I'm really scared to tell them that I'm going to be taking this medication.
Okay. It's important to have outside support and help from others, especially in helping you get through this and to keep an eye on you in case anything suddenly changes. Would you be willing, we can have them come pick you up and we can have a sit-down meeting with them if you're willing to, and I can always sit down with you in the meeting and talk about it with them.
I guess that would be helpful and really nice to have someone and not have me tell them alone.
Okay, so we'll get in contact them and we can have them come pick you up later today and we can sit down together and talk about this medication. So do you think you have any other questions?
I think you answered all my questions, thank you, and I have this packet too.
Okay, and that, again, that pamphlet is, all your answers should be in there. And remember, you can always reach out to us, your healthcare provider or pharmacist if you have any other questions about
Okay.
this medication.
Okay.
Okay.
Thank you.